I'm Adrian Ghobrial. Thanksgiving weekend is a time when families come together. We gather inside our homes, we sit around the table, we laugh, we eat, and we share what we're thankful for. Now, for the first time since the beginning of the pandemic, health officials are advising Ontario families to do just that with loved ones, though for some that will come with a level of anxiety. We begin with a word of caution and common sense from public health experts.
There's going to be some risk involved. The question is the risk level acceptable?
Medical officers of health from Queen's Park to cities across the province are giving their guidance this week.
If you're having family over and you're completely vaccinated, if you feel comfortable removing your masks, that would be absolutely appropriate in a fully vaccinated group.
Though if families are getting together with unvaccinated loved ones, the direction from the province's top doctor is either to spend time together outdoors or wear a mask inside. Both Peel and Toronto's medical officers echoed Dr. Moore's thoughts today.
So certainly having gatherings exclusively of those who are vaccinated, is the safest.
We have plenty to be thankful for. We are in a very different place this year because of the success of our vaccination rollout to date.
CityNews reached out to an infectious disease specialist and a public health professor to weigh in. Both said each family needs to examine their own risk factors.
Who's going to be there? So people might have different risks based on where they live, what they do throughout the day or what they do for work, who's vaccinated and who isn't. Like all of that would really feed into, what makes a safer gathering for Thanksgiving. Who's at higher risk in the situation? And, and again, is that risk acceptable or not? I think each family and group of people coming together would really have to sort of look at that.
Heading into the Thanksgiving weekend, people may well be having some anxiety.
Suze Burkout is a psychiatrist at Toronto's University Health Network.
One of the things that we say in mental health and psychiatry is that avoidance is the driver of anxiety. And so I would try to not procrastinate on having what might feel to be some challenging conversations, if that's going to be part of, if you're not sure about, say, people's vaccination status, and knowing that status is going to actually help you make a decision about your activities, or it's going to help you feel more comfortable. Don't avoid the conversations. Don't procrastinate until the last minute, because that just gives you this opportunity to think about it or ruminate on it over and over and over again.
One thing each medical professional agreed upon is the importance of finding that comfort and safely reconnecting with loved ones during such a trying time.
We want to minimize the spread. We want families to embrace the opportunity to get back together for their mental, physical, social well-being.
While Dr. Moore has shed some light on his Thanksgiving thoughts, his official recommendations for the holiday are expected to be released tomorrow.